Hearing the word cancer associated with your dog's name is a moment that can change everything. It's a heavy term, one that carries a lot of emotional weight, and it's completely natural to feel overwhelmed when you first hear it. The diagnosis can feel like a punch to the gut, leaving you reeling and unsure of what to do next. It's a moment that can freeze your world, bringing everything to a standstill as you try to process the information. The initial shock can be paralyzing, making it difficult to think clearly or make decisions. You might find yourself struggling to absorb what the veterinarian is saying, your mind racing with questions and fears. It's a word loaded with fear and uncertainty, conjuring up images of suffering and loss. The unknown can be terrifying, and the prospect of facing cancer with your beloved companion can feel incredibly daunting. You might worry about the impact on your dog's quality of life, the financial burden of treatment, and the emotional toll it will take on you and your family. As a veterinarian and pet lover myself, I know how devastating this feels. I've been on the other side of the table, both professionally and personally, and I understand the range of emotions you're experiencing. It's heartbreaking to see your furry friend struggling, and it's natural to feel helpless and scared. But take a deep breath. It's important to remember that you're not alone in this. Cancer is not always a death sentence. While it's a serious diagnosis, it doesn't automatically mean the end. Veterinary medicine has advanced significantly in recent years, offering more hope and treatment options than ever before. We now have access to cutting-edge therapies, advanced diagnostic tools, and a deeper understanding of canine cancer than ever before. This means that many dogs with cancer can live longer, happier lives with the right care. Your veterinary team is here to guide and support you every step of the way, providing you with the information, resources, and emotional support you need to navigate this challenging journey. We're committed to working with you to develop a personalized treatment plan that takes into account your dog's individual needs and circumstances, focusing on both effective treatment strategies and maintaining your dog's quality of life. Our priority is to ensure that your dog remains comfortable, happy, and engaged in the activities they enjoy for as long as possible. Our goal is to answer all of your questions honestly and thoroughly, addressing your concerns and providing you with a clear understanding of your dog's condition and treatment options. We want you to feel empowered to make informed decisions about your dog's care and create a comprehensive plan tailored specifically to your dog and your family's needs and preferences. We understand that every dog and every family is unique, and we'll work closely with you to develop a plan that fits your lifestyle and values. Knowledge is your best tool in this fight. The more you know, the better equipped you'll be to advocate for your dog's health and well-being. Understanding the specifics of the disease helps you make informed, compassionate decisions every step of the way. This includes understanding the type of cancer, its stage, and the available treatment options, as well as the potential side effects and benefits of each approach. We'll cover the basics of what cancer is, explaining how it develops and spreads in the body. We'll also discuss the early warning signs of cancer in dogs, helping you to recognize potential problems and seek veterinary attention promptly. And we'll walk you through what to expect from the diagnostic process and the various treatment options available. This will include information about blood tests, imaging, biopsies, surgery, chemotherapy, radiation therapy, and other therapies. You know your dog better than anyone else. You're the expert on their personality, habits, and quirks. Your observations of their behavior and physical condition are absolutely crucial for early detection and ongoing monitoring. Noticing subtle changes in their appetite, energy level, or bowel habits can be key to identifying potential problems early on. Together, working as a team, we can give your dog the best possible chance at fighting this disease for a longer, healthier, and happier life filled with love and joy. So let's begin this journey together with hope, with compassion, and with a clear and informed mind, ready to face whatever challenges may come our way. Remember, you're not alone, and we're here to support you and your beloved dog every step of the way. Cancer. It's a word that strikes fear in the hearts of pet owners everywhere. But what exactly cancer? At its core, cancer is the uncontrolled growth of abnormal cells in the body. It's a complex disease with many different forms, each with its own unique characteristics and challenges. Understanding the basics of what cancer is can help you be a more informed and proactive pet owner. Normally, cells grow, divide, and die in an orderly way. This process is tightly regulated by the body, ensuring that new cells are only created when they are needed, and old or damaged cells are removed. Think of it as a carefully choreographed dance, where each cell knows its role and performs it flawlessly. Cancer disrupts this delicate balance, causing cells to multiply unchecked. These rogue cells ignore the signals that tell them to stop growing and dividing, leading to a rapid and uncontrolled proliferation. This disruption can be triggered by a variety of factors, including genetic mutations, environmental toxins, and even viral infections. This leads to tumors, which are abnormal masses of tissue. Tumors can be benign, meaning they are non-cancerous and do not spread to other parts of the body, or malignant, meaning they are cancerous and have the potential to invade and destroy surrounding tissues and spread to distant sites. Determining whether a tumor is benign or malignant is a crucial step in diagnosing and treating cancer. Early detection is critical. The earlier cancer is detected, the better the chances of successful treatment and a positive outcome for your beloved dog. Catching cancer before it spreads, before it has a chance to establish itself and metastasize, means more effective treatment options are available. It allows veterinarians to target the cancer when it is most vulnerable, increasing the likelihood of remission or even a complete cure. Think of it like pulling a single weed before it overtakes your garden. It's much easier to remove one small weed than to try and eradicate an entire patch of them. The same principle applies to cancer. The smaller the tumor, the easier it is to treat. Cancer is common in older dogs. As dogs age, their cells are more likely to accumulate genetic damage, increasing their risk of developing cancer. And sadly, cancer is the leading cause of death in dogs over 10. This statistic underscores the importance of vigilance and proactive care as your dog enters their senior years. Regular veterinary checkups are essential, especially for senior dogs. These routine examinations allow your veterinarian to screen for potential health problems, including cancer, before they become advanced. Especially as your dog ages, these checkups become even more critical. Your vet can perform a thorough physical exam, run blood tests, and recommend other screening procedures to detect early signs of cancer. These visits help catch subtle changes you might miss at home. Your veterinarian is trained to recognize subtle signs of illness that you might not notice, such as a slight change in weight, a small lump, or a subtle shift in behavior. The goal is to be proactive, not reactive, about your dog's health. By scheduling regular checkups and being vigilant about your dog's well-being, you can take control of their health and increase their chances of living a long and happy life. Being informed and observant, paying close attention to your dog's behavior, appetite, and physical condition is key. Empowers you to act quickly if something seems off. Don't hesitate to contact your veterinarian if you notice any unusual symptoms or changes in your dog's health. You're your dog's best advocate. You know your dog better than anyone else, and you are in the best position to notice any subtle changes that might indicate a health problem. Early action can make all the difference in the fight against cancer, giving your furry friend the best possible chance at a long and healthy life. Cancer in dogs comes in many forms, each with unique traits. Lymphoma affects the lymphatic system and often responds well to chemotherapy. Mast cell tumors are skin cancers that can look like any bump, always have new lumps checked. Osteosarcoma, common in large breeds, causes painful leg swelling and often requires surgery and chemotherapy. Hemangiosarcoma is aggressive and can cause sudden internal bleeding, often with few warning signs. Routine senior wellness exams are vital for early detection. Early intervention can save lives. New lumps or bumps on your dog should always be checked by a vet. Don't wait and see. A quick needle aspirate can often diagnose the issue right in the clinic. Unexplained weight loss is a major red flag, even if your dog's appetite seems normal. Cancer can cause gradual weight and muscle loss. Persistent coughing or trouble breathing may signal cancer that's spread to the lungs. Sores that won't heal or unusual bleeding also require prompt veterinary attention. Early evaluation of these signs is crucial. Don't ignore subtle changes. Your vigilance matters. Early cancer signs can be subtle, like changes in appetite or behavior. A dog who suddenly loses interest in food or becomes unusually hungry is signaling something's wrong. Lethargy or loss of interest in play can indicate pain or illness, not just aging. Changes in bathroom habits, straining, accidents, or blood may point to urinary or digestive cancers. Persistent pain can show as limping, reluctance to move, or changes in temperament. Dogs often hide pain, so watch for shifts in their normal routine. Any lasting change deserves a vet visit. Trust your instincts, you know your dog best. Early action can uncover treatable problems. As a loving pet owner, you're your dog's first line of defense when it comes to their health. Regular checkups at the vet are crucial, but there's so much you can do at home to monitor their well-being. Make hands-on checks part of your routine. Petting with purpose can save lives. It's not just about cuddles, it's about consciously feeling for anything out of the ordinary. Systematically feel your dog from head to tail. Developing a consistent approach will help you notice even the smallest changes. Start at the nose and work your way down to the tip of the tail. Pay close attention, checking for new lumps, bumps, or changes in skin texture. Don't be afraid to gently probe and feel beneath the fur. Don't forget hidden spots. These are areas often overlooked, but can be just as susceptible to developing issues. Check carefully between toes, looking for any swelling, redness, or foreign objects. Also under legs, in the armpit area, where lumps can easily hide. Examine ears, both inside and out, for any signs of discharge, inflammation, or unusual odors. Gently lift the lips and inspect gums, and lips for any paleness, swelling, or sores. Healthy gums should be pink and moist. If you find a lump, don't panic, but do take it seriously. Note its size, texture, and location as accurately as possible. Is it hard or soft? Is it freely movable or attached to underlying tissue? Then call your vet. Describe the lump and its characteristics, and they'll advise you on the next steps. Remember, most lumps are benign, meaning they are not cancerous, but only a vet can confirm this through examination and potentially diagnostic tests like a needle aspirate or biopsy. Early detection allows for curative surgery in many cases, significantly improving your dog's prognosis. Removing small tumors with clean margins, meaning the entire tumor and a small area of surrounding healthy tissue are removed, can mean no further treatment like chemotherapy or radiation is needed, leading to a quicker and easier recovery for your furry friend. Your hands are your best diagnostic tool, readily available and always ready to provide comfort and detect potential problems. A few mindful minutes each week, dedicated to feeling and observing your dog, can make a huge difference in their long-term health and well-being. Stay alert. Be proactive in monitoring your dog's body, and you'll be more likely to catch any issues early on. Early action saves lives. It gives your dog the best chance at a long, happy, and healthy life by your side. Persistent coughing or labored breathing can signal serious illness, including cancer. Coughs lasting more than a few days or worsening need veterinary attention. Tumors in the lungs or chest can cause these symptoms, often from cancer that's spread. Watch for rapid, shallow, or difficult breathing, even at rest. Open-mouth breathing or stretching the neck to breathe is an emergency. These signs aren't exclusive to cancer, but always require prompt diagnosis. Your vet may recommend chest x-rays to identify the cause. Quick action can be life-saving. Diagnosis starts with a thorough exam and your detailed observations. Your vet will check for lumps, swollen nodes, and organ abnormalities. Blood work and urinalysis help assess overall health and spot cancer clues. If a mass is found, a biopsy or fine needle aspirate provides a diagnosis. Biopsies are the gold standard for identifying cancer type. Imaging, like X-rays or ultrasound, checks for spread and helps plan treatment. Advanced scans, CT, MRI, may be used for complex cases. Your input about symptoms and changes is vital. Early, accurate diagnosis guides the best treatment. Teamwork with your vet is key. Once cancer is diagnosed, your vet will discuss treatment options based on type, stage, and your dog's health. Surgery is common for localized tumors and can be curative. Chemotherapy is used for cancers that have spread. Most dogs tolerate it well with minimal side effects. Radiation targets tumors that can't be fully removed by surgery. Immunotherapy is an emerging option for some cancers. If a cure isn't possible, palliative care focuses on comfort and quality of life. Pain management, appetite support, and a loving environment are priorities. Every day should be as good as possible for your dog. Your choices honor your dog's dignity and happiness. Compassionate care is always the goal. G'day. Welcome to this important discussion about your dog's health and well-being. As a loving dog owner, you play a crucial role in ensuring your furry friend lives a long, happy, and healthy life. This chapter is dedicated to helping you understand that role and empowering you with the knowledge you need. Let's talk about something that worries many dog owners, a topic that can bring about feelings of anxiety and uncertainty. It's a subject that no pet owner wants to face, but one that we must address head-on for the sake of our beloved companions. Cancer. The very word can send shivers down your spine, and it's understandable to feel overwhelmed. Hearing that word in connection with your best mate is scary, and it's natural to feel a surge of emotions from fear and sadness to helplessness. The thought of your loyal companion battling such a disease is undoubtedly heartbreaking, but knowledge is your best tool. Understanding the disease, its signs, and what you can do is the first step in taking control and providing the best possible care for your dog. You know your dog better than anyone. You share a unique bond, a connection built on love, trust, and countless shared experiences. Their habits, their daily routines, their eating patterns, and their sleeping preferences, quirks, and moods. You're attuned to their individual personality, their playful antics, and their subtle shifts in behavior. That makes you the first line of defense, the primary observer, and the most important advocate for your dog's health. In spotting when something's off, you're the one most likely to notice those subtle changes in appetite, energy levels, or behavior that could indicate an underlying issue. This guide is here to empower you, to provide you with the information and confidence you need to be a proactive and informed pet owner, not frighten you. Our aim is to equip you with knowledge, not to instill fear or anxiety. We'll break down the signs of cancer in simple terms, making them easy to understand and recognize. Focusing on what matters, the key indicators that warrant attention and further investigation. Observation, the act of carefully and attentively watching your dog for any changes or abnormalities. And early action. Promptly seeking veterinary advice when you notice something concerning can make all the difference. Your attention is the most important diagnostic tool. Your keen eye and understanding of your dog's normal behavior are invaluable in detecting potential problems. By noticing subtle changes, those slight deviations from their usual self, you give your dog the best chance for a positive outcome. Early detection and intervention can significantly improve the prognosis and quality of life for your beloved pet. Remember, finding a symptom isn't a diagnosis, it's simply a piece of the puzzle. Many signs can be caused by less serious issues. A lump, for example, could be a benign cyst rather than a cancerous tumor. The goal is to make you a well-informed observer, capable of recognizing potential warning signs and communicating them effectively to your veterinarian. Not a worrier. We want you to be proactive and vigilant, but not consumed by anxiety or fear. You, the loving and dedicated owner, your dog, your cherished companion, and your vet are a team, a partnership dedicated to ensuring your dog's health and well-being. Working together is how you face any health challenge. Open communication, shared decision-making, and a collaborative approach are essential for navigating any health concerns that may arise. This guide helps you tune into your dog's silent language, to understand their body language, their subtle cues, and their unspoken needs, and act when needed. It empowers you to take proactive steps to protect your dog's health and seek veterinary care when necessary. Your attentiveness is a powerful form of love, a testament to the deep bond you share with your furry friend. And it's what your dog counts on every day. Your vigilance, care, and love are the cornerstones of their health and happiness. So, what exactly is cancer, and what does it mean for your beloved dog? It's a word that can bring a lot of worry, and it's important to understand what's happening inside their body. We're going to break it down in a way that's easy to grasp, so you can feel more informed and empowered. Let's keep it simple, because medical jargon can be overwhelming. We want to give you the essential information without getting lost in complicated details. Imagine your dog's body as a bustling city, a complex and organized place made of trillions of tiny cells, each with a specific job to do. These cells are all working together, all following rules, and communicating effectively to keep everything running smoothly. They grow, divide, and eventually die in a controlled and orderly manner. Cancer happens when some cells, for various reasons, decide to ignore those rules. They become rebellious, so to speak, and instead of following the normal growth patterns, they multiply uncontrollably, dividing rapidly and without any checks or balances. This uncontrolled multiplication leads to the formation of a mass, a tumor. It's like a building being constructed without a permit, growing larger and larger without any regulation. Now, it's important to know that some tumors are benign and harmless. They might cause some local issues, but they don't spread or invade other tissues. But malignant tumors are cancerous and can spread to other parts of the body, causing more serious problems. These are the tumors we worry about. This spreading, called metastasis, is when cancer cells break away from the original tumor and travel through the bloodstream or lymphatic system to establish new tumors in distant organs. This is why early detection is so important. The sooner we find cancer, the better our chances of stopping it before it spreads. Cancer isn't just one disease, it's a complex group of diseases, each with its own unique characteristics. It can affect any part of your dog's body, from the skin to the bones, from the blood to the major organs. There are many different types of cancer that can occur in dogs. Each type behaves differently, grows at a different rate, and responds differently to treatment. Therefore, each type needs specific treatment protocols. The causes of cancer are complex and often multifactorial. It's rarely just one single thing that leads to the development of the disease. Genetics or inherited traits can play a significant role in predisposing some dogs to certain types of cancer. Environment, including exposure to toxins, pollutants, and even certain viruses, can also contribute to the development of cancer. And aging itself is a factor, as the risk of cancer generally increases as dogs get older. Some breeds are more at risk for specific cancers than others due to their genetic makeup, but any dog, regardless of breed or age, can be affected. Most importantly, it's never your fault if your dog develops cancer. There's nothing you could have done differently to prevent it. Our job now is to face it with compassion, providing your dog with the love and support they need during this challenging time. Information is power. Understanding the disease, the treatment options, and what to expect can help you make informed decisions. And providing the best care possible, working closely with your veterinarian to develop a treatment plan that's tailored to your dog's specific needs. Understanding cancer helps us move from fear to action, allowing us to be proactive in our dog's care and advocate for their well-being. Many owners first notice something's wrong by finding a new lump during a cuddle. Not all lumps are cancerous, but never assume. Get them checked. Watch for changes. Is it growing, changing shape, or bothering your dog? Swelling in the belly, limbs, or lymph nodes can also be warning signs. If a lump is new, growing, or changing, see your vet. Better safe than sorry. A quick test like a fine needle aspirate can give you answers and peace of mind. You know your dog's personality best. A sudden drop in energy or a change in behavior can signal a health issue. Lethargy, withdrawal, irritability, or unusual clinginess may mean your dog is in pain or discomfort. Reluctance to move, limping, or hiding are also red flags. These signs aren't exclusive to cancer, but they always deserve attention. Don't dismiss changes as just getting old. Trust your instincts. Your observations are the first clues your vet needs. Early action can make all the difference. Listen to your dog's body breathing and eating habits reveal a lot. A persistent cough or labored breathing is always serious. See your vet right away. Loss of appetite that lasts more than a day or two is a major concern. Unexplained weight loss, even if your dog is eating, is a red flag. Cancer can cause these symptoms, but so can other illnesses. Watch for changes in body condition and appetite. Don't wait. Lasting changes mean it's time to call your vet. Early intervention saves lives. Occasional vomiting or diarrhea is normal, but persistent digestive issues are not. Chronic vomiting, diarrhea, or blood in either is a warning sign. Trouble eating, swallowing, or a sudden foul mouth odor can point to oral or digestive cancers. Excessive drooling or pain when eating also need attention. Don't ignore ongoing tummy troubles. Rule out serious causes. Many conditions can cause these signs, but persistence means it's time for a vet visit. Your vet can help get to the bottom of it and provide the right care. When you visit the vet, your observations are crucial. The vet will examine your dog thoroughly, checking for lumps, swelling, and organ changes. Blood tests and imaging like X-rays or ultrasound help reveal what's happening inside. If a tumor is suspected, a biopsy, taking a small tissue sample, confirms the diagnosis. This tells the vet what type of cancer it is and how aggressive it might be. All this information guides the best treatment plan. Early, accurate diagnosis is key to better outcomes. Your input and quick action make a real difference. A cancer diagnosis is tough, but it's not the end. You and your vet will choose the best path for your dog's quality of life. Surgery can remove many tumors, sometimes curing the cancer. Chemotherapy and radiation are options, often with fewer side effects than in humans. Palliative care focuses on comfort when a cure isn't possible. Every plan is tailored to your dog's needs and your wishes. Your vet will guide you with compassion and expertise. You're not alone on this journey. Early detection is your most powerful tool in the fight against canine cancer. It's about being proactive, observant, and understanding that time is of the essence. The sooner you identify a potential problem, the more options you have and the better the chances of a positive outcome for your beloved companion. Think of it as giving your dog a head start in a race against a formidable opponent. By knowing the signs, those subtle changes in behavior, appetite, or physical appearance, and acting quickly, you're not just a pet owner. You're your dog's advocate, their guardian angel. Don't dismiss anything as just getting old. Investigate any deviation from their normal routine. A lump, a persistent cough, unexplained weight loss. These are all red flags that warrant immediate attention. You give your dog the best chance at a longer, healthier, and happier life. Early intervention can mean the difference between managing a condition and potentially curing it. It's about maximizing their quality of life, ensuring they can continue to enjoy all the things they love: walks in the park, playtime with their favorite toys, and of course, endless cuddles. Regular vet checkups are essential, even when your dog seems perfectly healthy. These routine visits are opportunities for your veterinarian to identify potential problems before they become serious, especially as your dog ages. Senior dogs are more prone to certain types of cancer, making regular screenings even more critical. Think of these checkups as preventative maintenance, ensuring your dog's body is functioning optimally. Never hesitate to mention any concern, no matter how small or insignificant it may seem. Your observations are valuable and can provide crucial clues to your veterinarian. You and your vet form the best team for your dog's health. Open communication, shared decision-making, and a collaborative approach are key to providing the best possible care. If you need more help, don't be afraid to seek it out. There are numerous resources available to support you and your dog through this journey. Ask for a specialist, such as a veterinary oncologist, or join a support group where you can connect with other pet owners facing similar challenges. Sharing experiences and gaining insights from others can be incredibly helpful. You're not alone. Many others have walked this path, and their experiences can offer guidance and comfort. Remember, seeking support is a sign of strength, not weakness. Every decision should focus on your dog's quality of life, ensuring they can continue to enjoy their favorite activities and maintain a sense of well-being. It's about finding a balance between treatment and comfort, always prioritizing their happiness and comfort. Your love and vigilance are what matter most. They are the foundation of your dog's care and the driving force behind your efforts to protect their health. Keep up the cuddles, the gentle pets, and the loving words. These moments of connection are invaluable, providing comfort and reassurance to your dog during challenging times. Trust your instincts, because you know your dog better than anyone else. If something feels off, don't hesitate to investigate further. And know you're making a difference in your dog's life, providing them with the best possible care and support. Your dedication and love are truly making a positive impact. The bond we share with our dogs is profound. It's a connection built on unwavering loyalty, unconditional love, and countless shared moments. They wiggle their way into our hearts, becoming more than just pets. They become integral members of our families. They're family, not just pets. They share our homes, our meals, and our lives. Their presence enriches our days, offering comfort during tough times and celebrating our joys with enthusiastic tail wags. Because we know them so well, because we spend so much time observing their unique personalities and quirks, we're often the first to notice when something's off. We pick up on subtle changes in their behavior, appetite, or energy levels that might otherwise go unnoticed. That's why understanding health threats, being informed about the potential challenges our canine companions might face, like canine brain cancer, is so important. Early detection and intervention can significantly impact the outcome and quality of life for our beloved dogs. Knowledge lets us act quickly and confidently, empowering us to make informed decisions about their care and treatment. If our dogs need help, it allows us to communicate effectively with veterinary professionals and advocate for the best possible course of action. Facing a diagnosis like brain cancer is scary. It's natural to feel overwhelmed and anxious when confronted with such a serious health concern. But learning about it replaces fear with action. By educating ourselves, we can transform feelings of helplessness into proactive steps towards understanding and managing the condition. Recognizing symptoms, being aware of the potential warning signs, and knowing what to do can make all the difference. Early intervention can significantly improve the prognosis and quality of life for dogs diagnosed with brain cancer. This guide is here to empower you, not alarm you. Our goal is to provide you with the information and resources you need to navigate this challenging topic with confidence and compassion. By being aware, by staying informed and vigilant about your dog's health, you become your dog's best advocate and partner in care. You are their voice, their protector, and their unwavering source of support. Talking about tough topics like brain cancer, addressing difficult subjects head-on, is an act of love and responsibility. It demonstrates our commitment to their well-being and our willingness to face challenges together. Let's learn together. Let's embark on this journey of understanding and discovery as a community of caring pet owners, so we can give our dogs the best care, so we can provide them with the highest quality of life possible and the happiest lives possible. Because they deserve nothing less than our unwavering love, dedication, and the very best care we can provide. Canine brain cancer starts with a disruption in the normal cellular processes within the brain. It's a condition that can be frightening for pet owners, but understanding the basics is the first step in navigating this complex disease. We're going to break down what canine brain cancer is, how it develops, and why it poses such a significant threat to our beloved canine companions. At its core, brain cancer occurs when cells in the brain begin to grow uncontrollably, defying the body's natural mechanisms for regulating cell division and growth. These rogue cells multiply at an accelerated rate, leading to a cascade of problems within the delicate environment of the brain. This uncontrolled proliferation of cells results in the formation of a tumor, a mass of abnormal tissue that can disrupt the normal functioning of the brain. The tumor acts as a space-occupying lesion, interfering with the intricate network of neurons and neural pathways that govern everything from movement to behavior. Tumors are classified as either primary, meaning they originate directly within the brain tissue itself, arising from cells native to the brain, or secondary, indicating that the cancer has spread to the brain from another location in the body, a process known as metastasis. These secondary tumors often originate from cancers in organs such as the lungs, mammary glands, or skin. The main issue, regardless of whether the tumor is primary or secondary, is that any tumor, by its very nature, takes up valuable space inside the confined environment of the skull, a rigid structure that offers little room for expansion. As the tumor grows, it exerts increasing pressure on the surrounding brain tissue, compressing delicate structures and disrupting their normal function. This pressure disrupts movement, leading to incoordination, weakness, and difficulty walking. It also affects behavior, causing changes in personality, confusion, and disorientation, and interferes with basic functions such as appetite, sleep, and even consciousness. Tumors can be classified as benign, meaning they are typically slow-growing and less likely to invade surrounding tissues, or malignant, indicating that they are aggressive, rapidly growing, and prone to invading nearby brain tissue. But both benign and malignant tumors are serious due to their critical location within the skull and their potential to cause significant neurological damage. The specific symptoms that a dog exhibits will depend largely on which part of the brain is affected by the tumor. Even benign tumors, despite their slower growth rate and non-invasive nature, can cause severe problems simply because the skull is a rigid, unyielding structure that can't expand to accommodate the growing mass. Malignant tumors, on the other hand, tend to grow much faster and aggressively invade nearby brain tissue, causing widespread damage and neurological dysfunction. Therefore, any abnormal growth or mass detected in the brain warrants immediate veterinary attention and a thorough diagnostic evaluation to determine the nature of the growth and the best course of action. Early action, including prompt diagnosis and treatment, is absolutely crucial for achieving the best possible outcome and improving the dog's quality of life. As a dog owner, you're the first to spot changes in your pet's health. Sudden seizures, whether dramatic or subtle, are a major warning sign. Watch for clumsiness, circling, head pressing, or a persistent head tilt. Rapid eye movements, nystagmus, and loss of balance are also red flags. Behavioral shifts like withdrawal, aggression, confusion, or loss of interest can signal brain issues. Some dogs may seem lost in familiar places or stop responding to their name. Pain, changes in appetite, vision loss, or altered bark are other signs. Trust your instincts. You know your dog best. If you notice these symptoms, don't wait. Contact your veterinarian. Early intervention can make a real difference. Acting quickly is an act of love and responsibility. Your vet will start with a thorough physical and neurological exam guided by your observations. Blood and urine tests help rule out other causes and check your dog's overall health. Advanced imaging, MRI or CT scans, shows what's happening inside the brain. MRI is the gold standard for detailed images. CT is also useful and sometimes more accessible. Both require anesthesia for clear results. These tests confirm the presence, size, and location of a tumor. Accurate diagnosis is essential for planning treatment. This process ensures your dog gets the most effective care possible. Once diagnosed, your vet will discuss treatment options tailored to your dog's needs. The main treatments are surgery, radiation, and chemotherapy. Surgery removes as much of the tumor as possible, relieving pressure and symptoms. Radiation targets tumors that can't be surgically removed or to destroy remaining cancer cells. Newer techniques like stereotactic radiosurgery offer precise, fewer treatments. Chemotherapy uses drugs that can cross into the brain to slow tumor growth. Often, treatments are combined for the best results. The goal is always to improve your dog's quality of life. Your veterinary team will help you choose the best path forward. Treating brain cancer is a family journey focused on your dog's comfort and happiness. Most dogs tolerate treatment well, with fewer side effects than humans experience. The aim is to reduce symptoms and restore your dog's quality of life. You'll need to commit time and emotional energy, including vet visits and home care. Your role as caregiver and advocate is vital. Monitor your dog and communicate with your vet. Maintaining routines and a positive home environment helps your dog feel secure. Celebrate good days and cherish small moments together. Treatment is about maximizing joy and comfort, not just fighting disease. Your love and support are as important as any medicine. Early detection is your best tool against brain cancer. The sooner you notice symptoms, the more options your dog will have. Small tumors are easier to treat and less damaging. Subtle signs, like a wobble or confusion, are early warnings. Don't wait or dismiss changes as aging. Prompt action matters. A quick vet visit can rule out serious issues or catch problems early. Acting fast gives your dog the best chance for a positive outcome. Trust your instincts and be proactive. Early action empowers you and protects your dog's future. Treatment isn't just about more time, it's about better days for your dog. The goal is to relieve distressing symptoms and restore well-being. Imagine your dog free from seizures, pain, and confusion, enjoying walks and cuddles again. Quality of life is personal. Your vet can help you track it with simple tools. Ask yourself, is my dog still enjoying life and favorite activities? Treatment helps you answer yes for as long as possible. Choosing care is an act of love, prioritizing comfort and happiness. The true gift is the quality of the time you share. Focus on making every day meaningful and joyful. Discovering that your beloved canine companion is facing brain cancer can feel incredibly overwhelming. It's a moment filled with uncertainty, fear, and a multitude of questions swirling in your mind. You might feel lost, unsure of where to turn or what steps to take next. The diagnosis can be a heavy burden, leaving you feeling isolated and alone in this challenging journey. But please remember, you're not alone. Many pet owners have walked this path before, and there are resources and support systems available to help you navigate this difficult time. Your veterinary team is your primary resource. They are the first and most important point of contact for information, guidance, and support. They possess the medical expertise to accurately assess your dog's condition, explain the diagnosis in detail, and outline the available treatment options. Don't hesitate to ask questions and seek guidance. No question is too small or insignificant. It's crucial to understand every aspect of your dog's condition, the potential treatments, and the expected outcomes. Engage in open and honest communication with your vet to ensure you're making informed decisions that align with your dog's best interests and your personal circumstances. In addition to your vet, reputable websites and organizations can provide valuable information and support. Organizations like the Veterinary Cancer Society offer reliable information about canine brain cancer, treatment options, and supportive care strategies. These resources can help you better understand the disease and empower you to make informed decisions about your dog's care. Online support groups can also be a tremendous source of comfort and understanding. These groups connect you with others who understand your journey, offering a safe space to share your experiences, ask questions, and receive emotional support from people who truly understand what you're going through. Hearing from others who have faced similar challenges can provide invaluable insights and a sense of community. If cost is a concern, and it often is with cancer treatment, talk to your vet about payment plans and explore all available financial assistance options. Many veterinary clinics offer payment plans to help spread the cost of treatment over time, making it more manageable for pet owners. There's also financial aid from groups like the Pet Fund, which provides assistance to owners who need financial help with veterinary care. And Frankie's Friends, another organization dedicated to helping families afford life-saving veterinary care for their beloved pets. Don't hesitate to explore these options. Many families find them to be a crucial lifeline during challenging times. They exist to help families like yours, providing much-needed financial relief and ensuring that pets receive the care they deserve, regardless of their owner's financial situation. Remember to care for yourself too. This is a marathon, not a sprint. Supporting your dog through brain cancer treatment is emotionally demanding, physically draining, and mentally taxing. It's easy to become overwhelmed and neglect your own needs in the process. Lean on friends, family, and support networks for strength. Don't be afraid to ask for help with everyday tasks, errands, or simply someone to listen when you need to vent. Take breaks, even short ones, and find moments of peace when you can. Whether it's a quiet walk in nature, a relaxing bath, or simply spending a few minutes reading a book, prioritize activities that help you recharge and de-stress. Your well-being helps your dog feel safe and loved. Dogs are incredibly perceptive and can sense when their owners are stressed or anxious. By taking care of yourself, you're creating a more calm and stable environment for your dog, which can positively impact their well-being and response to treatment. By seeking knowledge and support from all available resources, you can face this challenge with hope, resilience, and a renewed sense of purpose. Together, you and your dog, bound by an unbreakable bond of love and companionship, can navigate this journey with courage, love, and unwavering determination, making the most of. Hearing your dog has cancer, specifically lymphoma, is undeniably terrifying. It's a moment filled with uncertainty and fear, a feeling that no pet parent ever wants to experience. The diagnosis can feel like a heavy weight, casting a shadow over the joy and companionship you share with your beloved canine friend. It's natural to feel overwhelmed, anxious, and unsure of what the future holds. But please remember, you're not alone in this journey. Many others have walked this path before you, and there's a wealth of support available to help you navigate the challenges ahead. Many pet parents have faced this difficult diagnosis, understanding the emotional roller coaster you're currently experiencing. They've grappled with the same questions, fears, and uncertainties. And thankfully, there's a strong community of fellow pet owners and expert veterinary care readily available to help you and your dog through this. This network of support can provide invaluable guidance, emotional comfort, and practical assistance as you navigate the complexities of canine lymphoma. This guide is here to empower you with the knowledge and resources you need to make informed decisions about your dog's care. We aim to provide you with a clear understanding of lymphoma, its treatment options, and how to best support your furry companion throughout this process. We'll provide you with clear, practical information about canine lymphoma, breaking down complex medical terms and concepts into easily understandable language. Our goal is to equip you with the knowledge you need to actively participate in your dog's treatment plan and advocate for their well-being. Knowledge helps turn fear into action, allowing you to feel more in control and less overwhelmed by the diagnosis. By understanding the disease and its treatment options, you can proactively work with your veterinarian to develop a plan that is tailored to your dog's specific needs and circumstances. This knowledge will empower you to focus on what truly matters: your dog's comfort, happiness, and overall quality of life. By prioritizing their well-being, you can ensure that they continue to enjoy their days to the fullest, despite the challenges they may be facing. A diagnosis is not an end, but rather the start of a new chapter in your dog's life, a chapter that may require adjustments and adaptations, but one that can still be filled with love, joy, and meaningful moments. This chapter will be one filled with love, unwavering support, and the deepening of the already strong bond you share with your furry friend. It will also be a testament to resilience, both your own and your dog's, as you navigate the challenges of treatment and recovery together. And above all, it will be a powerful reminder of the strength of your bond, a bond that can withstand even the most difficult of circumstances. This bond will be your anchor, providing you with the strength and motivation to persevere. In this guide, we'll break down what lymphoma is, explaining its different types and how it affects the body. We'll provide you with a comprehensive overview of the disease, empowering you to understand its complexities. We'll also explain how it's found through various diagnostic tests and procedures, and outline the range of treatment options available to you and your dog. Remember, every decision you make should center on your dog's quality of life, ensuring that they are comfortable, happy, and able to enjoy their days to the fullest. You know your dog best. You are the expert on their personality, their habits, and their unique needs. Therefore, your love and intuition are your greatest tools in navigating this journey. guiding you to make the best decisions for your beloved companion. Trust your instincts and advocate for your dog's well-being every step of the way. Take a deep breath. Allow yourself a moment of calm amidst the storm. We'll walk through this together, step by step, providing you with the information and support you need to navigate this challenging time. We'll cover the science behind lymphoma, explaining its causes, its progression, and its impact on your dog's body. We'll discuss the common symptoms of lymphoma in dogs, helping you to recognize potential signs of the disease and seek timely veterinary care. We'll explore the various treatment options available, including chemotherapy, radiation therapy, and supportive care, outlining the benefits and risks of each approach. And we'll also address the emotional side of this journey, acknowledging the challenges and providing resources for coping with the stress, anxiety, and grief that may arise. Remember, your love, combined with the right information, a supportive community, and expert veterinary care, can make all the difference in your dog's fight against lymphoma. So let's get started on this journey together, armed with knowledge, compassion, and unwavering hope. Canine lymphoma is a cancer of the immune system, specifically the lymphocytes, white blood cells that protect the body. When these cells grow uncontrollably, they form tumors, often in the lymph nodes. Lymphoma is a systemic disease, meaning it can affect many parts of the body at once. There are over 30 types, but multicentric lymphoma, affecting multiple lymph nodes, is most common. Other forms can involve the skin, digestive tract, or chest. The good news, lymphoma often responds well to treatments like chemotherapy. Understanding this cancer helps us choose the most effective options for your dog. Early detection is absolutely key when it comes to lymphoma in dogs. The sooner you identify potential issues, the better the chances for successful treatment and management. We can't stress enough how important it is to be vigilant. Get to know your dog's body and behavior intimately. Understand what's normal for them. This includes their energy levels, appetite, bathroom habits, and overall demeanor. Any deviation from their usual self should be noted and monitored. The most common and often first noticeable sign of lymphoma is swollen, firm, and typically non-painful lymph nodes. These nodes are part of your dog's immune system, and when they enlarge, it's a red flag. These swollen lymph nodes are often easily found under the jaw. Gently feel along your dog's jawline, comparing both sides for any noticeable lumps or bumps. Also check in front of the shoulders. The prescapular lymph nodes are located in this area, and swelling here is another common indicator. Don't forget the armpits. The axillary lymph nodes are located here, and they can become enlarged with lymphoma. Check the groin area as well. The inguinal lymph nodes are situated in this region and are another potential site for swelling. And finally, examine behind the knees. The popliteal lymph nodes are located here and are often easily palpable when enlarged. Regularly checking these areas will help you quickly identify any changes. Beyond swollen lymph nodes, lethargy and a noticeable loss of appetite are also frequent symptoms that should raise concern. Your dog may seem unusually tired or disinterested in activities they normally enjoy. Weight loss may follow, especially if their appetite significantly drops. Keep an eye on their food intake and body condition. A sudden decrease in weight without any dietary changes is a red flag. Depending on where the lymphoma is specifically affecting the body, you might observe vomiting. This is more common if the lymphoma is affecting the gastrointestinal tract. Diarrhea can also occur, particularly if the lymphoma is impacting the digestive system's ability to function properly. Coughing can be a symptom, especially if the lymphoma is present in the chest or affecting the lungs. You might also notice skin changes like unexplained red patches or the development of unusual lumps and bumps on the skin surface. It's important to remember that these symptoms can sometimes mimic less serious health issues, making it easy to dismiss them initially. However, don't ignore persistent changes or a combination of these symptoms. If something feels off, it's always best to err on the side of caution. Remember, you are your dog's first and most important line of defense when it comes to their health and well-being. If you happen to notice any of these signs, especially if you observe more than one symptom occurring simultaneously, it's crucial to contact your veterinarian promptly for a thorough examination and diagnosis. It's always better to be proactive and seek professional veterinary advice rather than waiting and hoping the symptoms will resolve on their own. Trust your instincts. You know your dog better than anyone else. Early action and intervention can make a significant difference in the outcome and your dog's quality of life. Your daily connection with your dog provides a powerful advantage in spotting subtle changes in their health and behavior. Pay close attention during playtime, feeding, and grooming. Stay observant, be proactive, and act quickly if you suspect something might be wrong. Your vigilance can make all the difference in ensuring your dog receives the timely care they need. At the vet, your dog will get a thorough exam, checking lymph nodes, temperature, heart, lungs, and abdomen. If lymphoma is suspected, a fine needle aspirate, FNA, collects cells from a lymph node for analysis, quick and minimally uncomfortable. Sometimes a biopsy is needed for more detail. Additional tests like blood work and imaging help determine how far the cancer has spread and guide treatment. This workup ensures your dog gets the safest, most effective care. Lymphoma is one of the most treatable dog cancers. The main goal is remission, giving your dog more good quality time. Chemotherapy is the gold standard, using lower doses than in humans to minimize side effects. Most dogs tolerate it well and maintain a good quality of life. Surgery or radiation may be options for localized cases, but are less common. Palliative care, like prednisone, can provide comfort if aggressive treatment isn't possible. Talk openly with your vet to choose the best plan for your family. Chemotherapy for dogs is much gentler than for humans. Quality of life is always the top priority. Treatment aims for remission, not a cure at all costs. Drug protocols are carefully chosen for effectiveness and tolerability. Most dogs experience few or mild side effects, maybe a day or two of decreased appetite or mild stomach upset. Significant sickness is rare. Hair loss is uncommon, except in certain breeds. Treatments are usually outpatient, with visits spaced over weeks or months. The CHOP protocol, a combination of drugs, is most common. Your veterinary team will monitor your dog closely and adjust as needed. The goal: keep your dog happy and comfortable throughout treatment. You're not alone, your vet team is your partner every step of the way. After diagnosis, the big question is, how much time do we have? With chemotherapy, most dogs achieve remission, lymph nodes shrink, and your dog feels well. Average survival is 10-14 months, sometimes longer with good quality of life. Some dogs may have shorter remissions or not respond as well, especially with certain lymphoma types. Without chemotherapy, survival is usually 1-3 months, but this time can still be comfortable. Focus on quality, not just quantity. Cherish the good days. Your vet can give a more personalized outlook based on your dog's case. Celebrate every moment together. Your support at home is vital. Provide a soft bed in a quiet spot and make your home easy to navigate. Gentle massages and calm routines help reduce stress. Nutrition matters. Work with your vet to keep meals appealing and balanced. Warm food or add safe toppers if appetite drops. Stick to a predictable routine and keep exercise gentle. Watch for signs of fatigue and let your dog rest as needed. Track appetite and energy and any side effects in a simple journal. Share this info with your vet to adjust care as needed. Don't hesitate to call your vet with concerns. Your careful observation is crucial for your dog's well-being. You are an essential part of your dog's care team. We've covered what lymphoma is, delving into its nature and how it manifests in our canine companions. It's a complex disease, and understanding it is the first step in navigating this journey. Remember, knowledge is power, and the more you know about lymphoma, the better equipped you'll be to make informed decisions about your dog's care. Symptoms: those subtle and sometimes not so subtle changes in your dog's behavior and physical condition that can signal something is amiss. Recognizing these signs early is crucial, as it allows for prompt veterinary intervention and potentially a more favorable outcome. Treatment: the various approaches available to combat lymphoma and improve your dog's quality of life. From chemotherapy to radiation therapy and even palliative care, there are options to explore with your veterinarian. Each treatment plan is tailored to the individual dog, taking into account their overall health, the stage of the lymphoma, and your personal preferences, and home care. This is where your love and dedication truly shine. Providing a comfortable, supportive environment at home is essential for your dog's well-being during and after treatment. This includes ensuring they have a nutritious diet, a clean and cozy place to rest, and plenty of opportunities for gentle exercise and affection. It's normal to feel overwhelmed, perhaps even a little lost. But please remember, you're not alone. Many other pet owners have walked this path, and there are resources and support systems available to help you navigate the challenges ahead. The goal is to add life to your dog's days, to ensure that even in the face of illness, they can still experience joy, comfort, and connection. It's about focusing on quality of life, making each day as fulfilling and meaningful as possible for your beloved companion. Every moment of comfort and joy matters. These are the moments that you'll cherish, the memories that will sustain you, and the experiences that will strengthen the bond between you and your dog. If you notice symptoms, schedule a vet visit right away. Don't delay, even if you're unsure. It's always better to err on the side of caution and seek professional advice. Early action gives the best chance for a positive outcome. The sooner lymphoma is diagnosed and treatment is initiated, the greater the likelihood of achieving remission and extending your dog's life. Trust your intuition. You know your dog best. You are the expert on your dog's unique personality, habits, and health. If something feels off, don't hesitate to voice your concerns to your veterinarian. Your veterinarian is your key partner in this journey. They are the medical professionals with the knowledge and experience to guide you through the diagnosis, treatment, and management of lymphoma, offering expertise and compassion. They understand the emotional toll that this disease can take on pet owners, and they are there to provide support and guidance every step of the way. Lean on friends, those who understand the special bond you share with your dog, and who can offer a listening ear, a helping hand, or simply a shoulder to cry on. Family, your loved ones who can provide practical assistance, emotional support, and a sense of normalcy during a challenging time. And online communities for support. These virtual spaces can connect you with other pet owners who are facing similar challenges, offering a sense of community, shared experiences, and valuable insights. Many organizations offer resources and connection, providing information, financial assistance, and emotional support to pet owners dealing with cancer. Reach out if you need help. Don't hesitate to ask for assistance, whether it's from your veterinarian, your friends and family, or a support organization. Thank you for caring so deeply for your dog. Your love and commitment are making a world of difference in their life. Your love and knowledge are powerful tools in navigating this journey. By staying informed, advocating for your dog's needs, and providing unwavering support, you are giving them the best possible chance at a fulfilling life. Cherish every wag, every sign of happiness and contentment, for these are the moments that remind us of the joy our dogs bring into our lives. Every cuddle, every warm embrace, for these are the expressions of love and connection that make our bond with our dogs so special. Every day. Make the most of each day, celebrating the simple joys of life with your dog, creating memories that will last a lifetime. You're giving your dog the greatest gift, the gift of your unwavering love, care, and support. A life filled with love and care, and that is the most powerful medicine of all. For more help, check resources like the AKC Canine Health Foundation, a non-profit organization dedicated to advancing the health of all dogs. Veterinary Cancer Society, a professional organization of veterinary oncologists dedicated to improving the lives of animals with cancer. And your local veterinary oncologist, a specialist in the diagnosis and treatment of cancer in animals. They can provide the most up-to-date information and treatment options for your dog's specific condition. As pet parents, our dogs are family, and their health is our responsibility. Part of caring for them means being aware of issues like cancer, even though it can be scary. Mammary cancer, similar to breast cancer in humans, is one of the most common cancers in female dogs. The good news, with early detection and modern veterinary care, many dogs live happy, full lives after diagnosis. This guide will give you the essentials: what to look for, what to expect, and how to act. You are your dog's first line of defense. Your attention and care are powerful tools in keeping her healthy. Many mammary tumors are benign, but some are malignant, so every lump matters. We'll break down risk factors, signs to watch for, and what happens at the vet. Think of this as a conversation to help you make the best choices for your furry family member. You don't need to be a veterinary expert, just a caring, observant partner. Early action can make all the difference. Let's start this journey together and learn how to protect our precious girls. Your love and vigilance are the best gifts you can give your dog. I'm here to guide you every step of the way. Mammary cancer is the uncontrolled growth of cells in a dog's mammary glands. Female dogs have 10 mammary glands along their underside, and tumors can develop in any of them. About half of these tumors are malignant and can spread. The other half are benign. You can't tell if a lump is dangerous just by touch. Every new lump needs a vet check. Unspayed females are at highest risk, especially as they age. Hormones like estrogen and progesterone play a big role in tumor growth. Most cases are seen in dogs between 8 and 11 years old. Certain breeds, poodles, dachshunds, spaniels, and German shepherds are more prone. Genetics matter, but any female dog can be affected. If your dog is a higher risk breed or older, be extra diligent with checks. Knowing the risks helps you stay ahead. Get to know your dog's body with regular belly rubs and gentle checks. The most common sign is a small, firm lump under the skin along her belly. Lumps can be single or multiple, soft or hard, and may not cause pain. Always check around each nipple for anything new or unusual. If you find a lump, call your veterinarian. Don't wait to see if it changes. Other warning signs: redness, swelling, open sores, or discharge from the lump. Swollen lymph nodes in the armpit or groin, loss of appetite, or lethargy can signal advanced disease. Inflammatory mammary carcinoma is aggressive. Look for sudden, painful swelling, redness, or warmth. This is a medical emergency. Contact your vet immediately if you see these signs. Early detection is key to successful treatment. Make these checks a monthly habit. Your hands can catch trouble before it becomes serious. Stay alert and act quickly. Spaying is the single most important step to reduce mammary cancer risk. The earlier a dog is spayed, the lower her risk. Spaying before the first heat drops risk to almost zero. After the first and second heats, risk rises sharply. Spaying after multiple heats doesn't offer the same protection, but still prevents other health issues. Mammary cancer is mostly seen in middle-aged and older dogs, rarely under age 5. As dogs live longer, regular wellness exams become even more important. Certain breeds, poodles, spaniels, German shepherds, are more susceptible, likely due to genetics. No genetic test exists yet, but knowing your dog's breed helps guide vigilance. If you don't know her breed, focus on regular checks and timely spaying. Talk to your vet about the best timing for spaying. Prevention and early action are universal keys. Stay proactive for your dog's health. If you find a lump, your vet will start with a thorough physical exam. They'll check the lump's size, location, and nearby lymph nodes. Fine needle aspirate, FNA, is a quick test to sample cells, but may not give a full answer. A biopsy, removing a small piece or the whole lump, provides a definitive diagnosis. The tissue is sent to a lab to determine if it's benign or malignant. If cancer is found, grading helps predict how aggressive it is. Chest X-rays check for spread to the lungs, and blood work ensures your dog is healthy for surgery. These steps guide the best treatment plan. Early, thorough investigation is crucial. Surgery is the main treatment for canine mammary cancer. The goal is to remove the tumor completely, often with a margin of healthy tissue. If the cancer is aggressive or has spread, chemotherapy may be recommended. Chemo for dogs is usually well tolerated and aims to improve quality of life. Hormone therapy is rare but may be used for certain tumor types. Your vet will tailor treatment to your dog's needs and comfort. You're not alone. Your veterinary team will guide you through every step. The focus is always your dog's best possible quality of life. Early surgery offers the best chance for a cure. Small, well-defined tumors are easier to remove and less likely to have spread. More extensive surgery may be needed for larger or multiple tumors. Most dogs recover quickly with good pain management. Early detection means better outcomes. Smaller tumors removed sooner lead to higher success rates. If your dog isn't spayed, vets often recommend spaying during tumor removal. This reduces hormone-driven risks and prevents other health issues. Acting quickly can make all the difference. Prevention starts with early spaying before the first heat is best. Spaying eliminates the main hormonal driver of mammary tumors and prevents other serious health problems. It's a simple, one-time investment in your dog's future. Regular vet exams are essential, especially as your dog ages. Vets are trained to spot subtle changes you might miss. For senior dogs, checkups every 6 months are ideal. At home, make monthly belly checks part of your routine. Know what's normal for your dog so you can spot changes fast. If you find anything unusual, call your vet right away. Your vigilance is a powerful tool for a long, healthy life. You are your dog's best advocate. Trust your instincts. If you find a lump or anything unusual, contact your vet immediately. Don't wait. Early action gives the best chance for a good outcome. Your vet is your partner. Ask questions and seek clarity about diagnosis, treatment, and recovery. Use trusted sources for information, major veterinary organizations, and university vet schools. Avoid unreliable internet advice that can cause confusion or worry. With early spaying, regular checks, and prompt action, you can make a real difference. Modern veterinary care offers hope and effective treatment. Your love, combined with knowledge, is your dog's best protection. stay informed, stay proactive, and cherish every moment with your furry friend. Our dogs are more than just pets. They are beloved family members, integral parts of our lives, and sources of unconditional love. They share our homes, our adventures, and our quiet moments. And because they are so important to us, their health and well-being is our responsibility. We feed them, shelter them, and shower them with affection. But responsible pet ownership also means being proactive about their health. Being aware of potential health issues that can affect our canine companions, like skin cancer, is a crucial aspect of this responsibility. This awareness empowers us to take the necessary steps to protect them and ensure they live long, healthy, and happy lives by our sides. Skin cancer in dogs can sound scary and overwhelming, especially when you consider the potential impact on your furry friend's life. But remember, knowledge is our best defense against the unknown. Understanding the risks, signs, and treatment options can make all the difference. Early detection is absolutely key. It's the cornerstone of successful treatment and improved outcomes. The good news is that most skin cancers in dogs are treatable and often curable if caught in the early stages. This highlights the importance of regular checkups and vigilant observation. Regular skin checks, just like brushing their teeth or trimming their nails, should be an integral part of your dog's grooming routine. These checks should be a consistent and mindful part of your routine, allowing you to identify any abnormalities or changes in their skin. You know your dog best. You understand their unique personality, habits, and physical characteristics. Because of this deep connection, trust your instincts implicitly if you notice any unusual lumps, bumps, discolorations, or changes in their skin. In this guide, we'll cover in detail what skin cancer is in dogs, providing you with a comprehensive understanding of the disease. We'll explore what causes it, examining the various risk factors and environmental influences that can contribute to its development. We'll also delve into the common types of skin cancer that affect dogs, helping you differentiate between them. We'll outline the key signs and symptoms to watch for, empowering you to identify potential problems early on. We'll discuss the diagnostic process, explaining how veterinarians determine the presence and extent of skin cancer. We'll review the various treatment options available, from surgery and chemotherapy to radiation therapy and palliative care. And finally, we'll emphasize the importance of prevention, providing practical tips and strategies to minimize your dog's risk of developing skin cancer. The ultimate goal is to turn concern into proactive action, equipping you with the knowledge and tools to safeguard your dog's health. By taking a proactive approach, you can help keep your dog healthy, happy, and enjoying life to the fullest for many years to come. So, let's get started on this journey together, learning how you can be your dog's best advocate and protector against skin cancer. Let's simplify what skin cancer means for dogs. It's a term that can sound scary, but understanding the basics can empower you to take the best possible care of your furry friend. We're going to break down the complexities and make it easy to grasp. Cancer, in its simplest form, is when abnormal cells within the body begin to grow uncontrollably. These cells disregard the normal signals that tell them when to stop growing and dividing. This unchecked growth often leads to the formation of lumps, bumps, or sores on the skin that, unlike normal wounds, just don't seem to heal properly. They might bleed, crust over, or simply persist for an unusually long time. Now, it's crucial to remember that not all lumps are cancerous. Some are benign, meaning they are not harmful, while others are malignant, indicating a cancerous condition. Distinguishing between the two is a key part of the diagnostic process. Benign tumors are generally localized and don't spread to other parts of the body, but malignant ones have the potential to invade surrounding tissues, causing damage and disruption. Even more concerning, malignant cells can break away from the original tumor and travel through the bloodstream or lymphatic system to establish new tumors in other organs, a process called metastasis. Skin cancer specifically refers to malignant tumors that originate in the various cell types that make up the skin, such as melanocytes, epithelial cells, or connective tissue cells. The specific type of skin cancer is named based on the type of cell from which it originates. For example, a melanoma arises from melanocytes, the pigment-producing cells in the skin. Your veterinarian's crucial job is to carefully examine any suspicious growths on your dog's skin, paying close attention to their size, shape, color, and texture. They will then perform tests, such as biopsies, to determine definitively whether these growths are benign or malignant, providing a clear diagnosis. Based on the diagnosis, your vet will develop a tailored treatment plan, which may involve surgery, chemotherapy, radiation therapy, or a combination of these approaches, depending on the type and stage of the cancer. Early detection and prompt action are absolutely critical in achieving the best possible outcome for your dog. The sooner a problem is identified and addressed, the greater the chances of successful treatment and recovery. Understanding these basic principles of skin cancer empowers you to be a proactive advocate for your dog's health, enabling you to spot potential problems early and seek timely veterinary care. Now, let's delve into the various factors that can contribute to the development of skin cancer in dogs, exploring the potential causes and risk factors. Why does skin cancer happen in dogs? The answer is usually a mix of factors. Genetics play a big role. Some breeds like boxers and golden retrievers are more prone. Sun exposure is another major risk, especially for light-colored or thin-coated dogs. Areas with less fur, like the belly and ears, are most vulnerable. A weakened immune system from age or illness can also increase risk. You can't change genetics, but you can limit sun exposure and support your dog's health. Awareness of these factors helps you take preventive steps. Now, let's explore the most common types of skin cancer in dogs. Skin cancer in dogs comes in several forms, each presenting its own unique challenges and requiring specific approaches to diagnosis and treatment. Just like in humans, early detection is paramount when it comes to successfully managing these conditions in our canine companions. Understanding the different types of skin cancer that can affect dogs is the first step in ensuring their well-being, each with unique traits. These traits influence how the cancer behaves, how quickly it spreads, and what treatment options are most likely to be effective. Recognizing these differences is crucial for both pet owners and veterinarians. Mast cell tumors are the most common, accounting for a significant portion of all skin cancers diagnosed in dogs. These tumors arise from mast cells, which are a type of immune cell found throughout the body. These can look like anything from a small bump, easily mistaken for an insect bite or skin tag, to a large sore, ulcerated and causing discomfort to your pet. The appearance can be deceiving, making regular skin checks essential, and may spread quickly. Mast cell tumors have the potential to metastasize or spread to other parts of the body, including the lymph nodes, liver, and spleen. This makes early diagnosis and treatment all the more critical. Malignant melanoma often appears in the mouth or on the feet, areas that might be easily overlooked during regular grooming or checkups. These locations can make detection more challenging and can be aggressive. Melanoma in these locations tends to be more aggressive than melanoma found on other parts of the body, requiring prompt and aggressive treatment. Squamous cell carcinoma usually shows up on sun-exposed areas like the nose or belly, particularly in dogs with light-colored skin or thin fur. These areas are more vulnerable to the damaging effects of ultraviolet radiation, often as firm, wart-like sores. These sores may bleed easily or fail to heal properly, signaling a potential problem that warrants veterinary attention. Dermal hemangiosarcoma is a cancer of blood vessel cells, developing in the skin and subcutaneous tissues. It's a type of cancer that requires careful monitoring and treatment, often seen as reddish bumps on light-skinned dogs. These bumps may appear suddenly and can grow rapidly, making them easily noticeable. Early detection and surgical removal, when possible, are key for all these cancers. Surgical removal aims to completely excise the cancerous tissue, preventing further spread and recurrence. Some are more aggressive than others, with varying rates of growth and metastasis. Understanding the specific type of cancer and its potential behavior is crucial for developing an effective treatment plan. But prompt action improves outcomes. The sooner a diagnosis is made and treatment is initiated, the better the chances of controlling the cancer and improving your dog's quality of life. Knowing these names helps you understand your vet's diagnosis, allowing you to participate more actively in decisions about your dog's care. It empowers you to ask informed questions and seek the best possible treatment options. Next, let's talk about what signs to watch for on your dog's skin. Regular skin checks are a vital part of responsible pet ownership. Spotting changes early can save lives. Early detection allows for prompt intervention, which can significantly improve the prognosis for many types of skin cancer. Here's what to look for. By being vigilant and knowing what to look for, you can play a crucial role in protecting your dog's health and well-being. You're your dog's first line of defense. Regular skin checks are vital. Watch for new lumps or bumps, especially if they change in size, shape, or color. Any sore or ulcer that doesn't heal within a week is a red flag. Changes in existing moles or pigmented spots like growth, color change, or irritation should be checked. Look for scaly, crusty, or discolored patches and persistent itching or licking at one spot. While many lumps are harmless, only a vet can tell for sure. Trust your instincts. If something seems off, get it checked. Early action is the best way to protect your dog. Let's see how vets diagnose skin cancer. Here's what to expect at the clinic. If you find a suspicious spot, your vet will start with a thorough exam. They'll check the lump's size, location, and feel, and look for other unusual areas. A fine needle aspirate, FNA, is often the first test, using a small needle to collect cells for analysis. For a definitive answer, a biopsy may be needed, where a tissue sample is sent to a lab. If cancer is confirmed, further tests like blood work or imaging may be done to check for spread. This information guides the treatment plan and prognosis. Accurate diagnosis is crucial for the best outcome. Now let's look at treatment options. A cancer diagnosis is tough, but there are effective treatments. Surgery is the main treatment for most skin cancers, removing the tumor and some healthy tissue. For small, localized tumors, surgery alone can often cure the cancer. If the tumor is large or in a tricky spot, radiation therapy may be used to target remaining cancer cells. Chemotherapy is used for cancers that have spread or are high risk, aiming to slow progression and improve quality of life. Most dogs tolerate treatment well and stay happy during therapy. Early detection makes treatment simpler and more successful. Prevention is just as important. Let's talk about how to lower your dog's risk. While not all skin cancers can be prevented, you can lower your dog's risk. Limit sun exposure, especially for light-skinned or thin-coated dogs. Avoid peak sun hours and provide shade. Use dog-safe sunscreen on vulnerable areas like the nose and ears and belly. Consider UV protective clothing for high-risk dogs or outdoor adventures. Perform monthly at-home skin checks. Feel for lumps, look for sores or color changes. Don't forget hidden spots like between toes and inside the mouth. Schedule regular vet checkups for professional exams. Prevention is about small, consistent habits. Staying proactive keeps your dog safer and healthier. Here's when to call the vet and where to learn more. If you notice anything new, changing, or concerning on your dog's skin, call your vet. Don't wait. Early checks are always better than late regrets. Report new lumps, non-healing sores, or changes in existing spots. Persistent licking or scratching at one area also deserves attention. Be ready to share when you first notice the change and how it's evolved. Your vet is your partner. Ask questions and stay informed. Trusted resources include the American Veterinary Medical Association and your own vet's advice. By staying alert and informed, you give your dog the best chance at a long, joyful life. Thank you for being a caring... G'day everyone. I'm here today to connect with you on a topic that, while difficult, is incredibly important for us to address as pet owners and animal lovers. It's a conversation that requires sensitivity, understanding, and a willingness to face some hard truths. Today, we need to talk about something tough, a diagnosis that no dog owner ever wants to hear. It's a conversation that might bring up feelings of anxiety and concern, and that's perfectly understandable. We're going to discuss canine osteosarcoma. This is a type of bone cancer that primarily affects dogs, and it's something we need to understand better to protect our furry friends. It's the most common bone cancer in dogs, accounting for a significant percentage of all primary bone tumors diagnosed in our canine companions. It's a serious condition that requires our attention and understanding. And hearing this diagnosis is devastating. It can feel like the world is crashing down around you, and the future you envisioned with your beloved pet suddenly seems uncertain. The news brings fear and uncertainty, a whirlwind of questions and anxieties about what lies ahead for your dog and for you. It's a natural reaction to such a challenging situation, but those feelings are normal. It's okay to feel scared, overwhelmed, or even angry. Acknowledging these emotions is the first step towards navigating this difficult journey. My goal is to guide you through this, to provide you with the information and support you need to make informed decisions about your dog's care, so you feel empowered, equipped with the knowledge and understanding to actively participate in your dog's treatment plan and advocate for their well-being, not overwhelmed. We want to break down the complexities of osteosarcoma into manageable pieces, so you can focus on what truly matters, providing love and support to your dog. By understanding osteosarcoma, its causes, its progression, and the available treatment options, you'll be better prepared to face this challenge head-on. You can advocate for your dog, ensuring that their voice is heard and their needs are met throughout the entire treatment process, and ensure they get the best care, the most appropriate and compassionate care possible, tailored to their individual needs and circumstances. Our dogs are family, they're integral parts of our lives, offering us unconditional love, companionship, and unwavering loyalty. And when their health is threatened, it hits hard. It shakes us to our core, reminding us of the preciousness and fragility of life. This guide is for every owner who shares that deep bond, that unbreakable connection with their canine companion. It's for those who would do anything to ensure their dog's comfort and well-being. We'll focus on hope, on the possibilities that exist even in the face of a challenging diagnosis. We'll explore the advancements in veterinary medicine that offer new avenues for treatment and management, practical steps, actionable strategies that you can implement to support your dog's health and quality of life throughout their treatment journey, and the love that defines your relationship. The unwavering affection, the shared moments of joy, and the deep connection that makes your bond with your dog so special. Let's take a deep breath and start this journey together. Remember, you're not alone, and we're here to support you every step of the way. So what is osteosarcoma? Simply put, it's an aggressive bone cancer. It starts in bone-forming cells, causing pain and making bones fragile. Osteosarcoma often targets the long bones of large and giant breed dogs. Think Rottweilers, Great Danes, and Golden Retrievers. The classic sites are near the shoulder, wrist, and knee. By the time we notice a limp, cancer cells may have already spread, especially to the lungs. That's why early comprehensive treatment is so important. Middle-aged to older dogs are most at risk, but young dogs can be affected too. Knowing these risks helps us stay vigilant. One of the hardest questions is, why my dog? Osteosarcoma is likely caused by a mix of genetics and environment. There's nothing you did wrong. The biggest risk factor is size. Large and giant breeds are most affected, likely due to rapid growth and stress on their bones. Certain breeds like Rottweilers and Irish Wolfhounds have a genetic predisposition. Rarely metallic implants or early spay-neuter may play a role, but evidence is limited. The main takeaway: most risk factors are out of your control. Focus on awareness, not guilt. As our beloved companions, dogs hold a special place in our hearts and homes. We cherish their playful antics, their unwavering loyalty, and the unconditional love they shower upon us. But unlike humans, dogs can't verbally express when they're experiencing pain or discomfort. They rely on us, their attentive guardians, to recognize the subtle cues and signals they exhibit when something isn't quite right. While they can't tell us directly, they show us through changes in behavior, posture, and overall demeanor. Recognizing these signs is crucial for ensuring their well-being and providing them with the care they need. The earliest and often most noticeable sign of potential bone cancer or other orthopedic issues is usually a limp. This might start subtly, perhaps only appearing after exercise. Initially, the limp might seem minor, and you might think it will improve with rest. However, with bone cancer, the limp doesn't improve and gradually worsens over time. It becomes more consistent, affecting their ability to move comfortably. Another common indicator is swelling near a joint, especially in the legs. This swelling is a result of the tumor growth and the body's inflammatory response. It can be subtle at first, but it will progressively increase in size. The affected area may be sensitive to the touch. Even gentle pressure can cause discomfort. As the condition progresses, your dog might yelp, whine, or pull away when you try to touch or examine the affected area. They may also become protective of the limb, guarding it from any potential contact. The persistent pain associated with bone cancer can significantly impact their personality and overall behavior. They may become withdrawn, less interested in interacting with family members, or even irritable, displaying uncharacteristic aggression when approached. Some dogs may start hiding, seeking solace in quiet, secluded spots. A noticeable decrease in appetite is another red flag. The pain and discomfort can make eating less appealing. As a result of reduced food intake, you might observe unintentional weight loss, despite maintaining their regular diet beforehand. You might also notice a reluctance to engage in activities they once enjoyed, such as walks, playing fetch, or simply running around the yard. They may become lethargic, preferring to lie down and rest for extended periods. In severe and advanced cases, the affected bone can become so weakened by the tumor that it breaks spontaneously or with very little force. This pathological fracture causes acute and intense pain, leading to significant distress and requiring immediate veterinary attention. As a pet owner, you know your dog best. Trust your instincts. If something feels off or you notice a combination of these symptoms, don't hesitate to schedule a visit with your veterinarian. Early detection and diagnosis are paramount in achieving better treatment outcomes and improving your dog's quality of life. Be especially vigilant about any persistent limping, particularly in large breeds, as they are more predisposed to developing bone cancer. Remember, your dog's subtle signals are their way of communicating their discomfort and asking for your help. They rely on you to be their advocate and seek the necessary medical attention. Acting quickly and seeking veterinary care promptly can make all the difference in managing their condition and ensuring their comfort and well-being. When you bring your limping dog to the vet, the process starts with a thorough exam and questions about the symptoms. X-rays are the main diagnostic tool. Osteosarcoma has a distinct appearance on them. Chest X-rays check for spread to the lungs. For a definitive diagnosis, a biopsy is needed to confirm cancer cells. Sometimes advanced imaging like a CT scan helps plan surgery and check for metastasis. This full workup gives your vet the information needed for the best treatment plan. Quick, accurate diagnosis is crucial for your dog's care. The sooner you act, the more options you have. Once diagnosed, treatment aims to control pain and slow the cancer's spread. The gold standard is surgery, usually amputation plus chemotherapy. Amputation removes the painful tumor and prevents fractures. Chemotherapy targets cancer cells that may have spread, often doubling survival time. Most dogs tolerate chemo well, with minimal side effects. Pain management is essential throughout, using medications and sometimes palliative radiation. For dogs who can't have surgery, radiation can ease pain and improve mobility. The goal is always quality of life. Amputation sounds drastic, but dogs are incredibly resilient. They don't dwell on lost limbs. They just want to be pain-free. Most dogs walk within days of surgery and quickly adapt to 3 legs. With encouragement and a few home adjustments, they regain their joy and mobility. Non-slip rugs and supportive harnesses help during recovery. Keeping your dog lean reduces strain on their joints. Owners often see their dog's personality return after surgery. The pain is gone and their spirit shines. Amputation gives them a new lease on life. Quality of life is about happiness, not the number of legs. Your positive attitude helps your dog thrive. Their resilience is truly inspiring. Osteosarcoma is an incredibly aggressive form of cancer that primarily affects the bones of dogs. It's a diagnosis that no pet owner wants to hear, and it often brings with it a wave of uncertainty and difficult decisions. Understanding the nature of this disease is the first step in navigating the challenges ahead. And while a cure is, unfortunately, rarely achievable with osteosarcoma, it's important to remember that treatment options are available. These treatments can significantly improve your dog's quality of life, providing them with more good days filled with comfort and joy. The goal is to manage the pain and slow the progression of the disease, allowing you to cherish the time you have left together. Without any intervention or treatment, the survival time for a dog diagnosed with osteosarcoma is typically limited to just 1 to 2 months. This is a stark reality, highlighting the importance of exploring available options to extend your dog's life and maintain their well-being. Palliative care, which focuses on managing pain and improving comfort, can extend this time frame to approximately 4 to 6 months. This approach prioritizes your dog's comfort and aims to minimize suffering, allowing them to enjoy a more peaceful and dignified end of life. The key focus of palliative care is ensuring a good quality of life for your beloved companion during this challenging time. This means managing pain effectively, providing a comfortable environment, and catering to their emotional needs. Amputation of the affected limb, combined with chemotherapy, often offers the best chance for extending your dog's life expectancy and improving their overall prognosis. This aggressive approach aims to remove the primary source of pain and slow the spread of cancer cells throughout the body. With amputation and chemotherapy, many dogs can live for 10 to 12 months or even longer, experiencing a relatively good quality of life. There are even cases of dogs surviving well beyond this time frame, becoming long-term cancer survivors and defying the odds. Early detection of osteosarcoma plays a crucial role in improving treatment outcomes and extending your dog's life. The sooner the cancer is diagnosed, the sooner treatment can begin, increasing the chances of success. So, if you notice any signs of lameness or limping in your dog, it's essential to seek veterinary attention without delay. Prompt diagnosis and treatment can make a significant difference in their prognosis. Ultimately, the focus should be on making every day count, ensuring that your dog's remaining time is filled with love, comfort, and joy. This means prioritizing their well-being and creating positive experiences that they can cherish. Indulge them with special treats, offering their favorite flavors and textures to stimulate their appetite and bring them pleasure. Take them on their favorite walks, allowing them to enjoy the sights, sounds, and smells of the outdoors, even if it's just a short stroll around the block. And shower them with extra cuddles, providing them with the physical affection and reassurance they need during this challenging time. Cherish the present moment and create joyful memories that you can hold on to long after your dog is gone. These memories will serve as a lasting tribute to the special bond you shared. The time you gain with your dog through treatment and palliative care is a precious gift, allowing you to create lasting memories and strengthen your bond. Your unwavering love and compassionate care will make all the difference in your dog's comfort and well-being during this difficult journey. They will feel your love and support every step of the way. Celebrate each moment together, finding joy in the simple things and cherishing the special bond you share with your beloved companion. An osteosarcoma diagnosis can feel isolating, but you're not alone. There are supportive communities, both online and in person, for owners facing canine cancer. Groups like Tripods and Canine Cancer Support offer advice and understanding. Reliable websites provide up-to-date information and resources. Your veterinary team is your main partner. Ask questions and lean on their expertise. Open communication helps you make the best choices for your dog. Hope isn't just about a cure, it's about comfort, joy, and love. Focus on good days and shared moments. Trust your instincts and support network. Your love is the greatest gift you can give your dog. Our dogs are more than just pets. They're cherished members of our families. They share our homes, our lives, and our hearts. They greet us with boundless enthusiasm, offer unwavering loyalty, and provide comfort during difficult times. The bond we share with them is unique and precious. And because they are family, their health and well-being is our utmost priority. We want them to live long, happy, and healthy lives by our sides. This means providing them with proper nutrition, regular exercise, and, of course, attentive veterinary care. So when something seems off, when their behavior changes, or when they exhibit unusual symptoms, it's completely natural to worry. We want to understand what's happening and how we can help them feel better. The uncertainty can be unsettling, and the desire to alleviate their discomfort is strong. This guide is designed to help you understand a serious issue that can affect our canine companions, gastrointestinal cancer. We'll delve into what it is, how it manifests, and what it means for your dog's health. Knowledge is power, especially when it comes to your dog's health. Knowing what to look for in terms of symptoms, understanding the diagnostic process, and being aware of how it's treated can significantly help you feel more prepared to navigate this challenging situation. It empowers you to be a proactive advocate for your dog's well-being. Facing a health problem, particularly something as serious as cancer, in your dog is undoubtedly tough. It's emotionally draining and can leave you feeling helpless. But remember, you're not alone. Many other pet owners have faced similar challenges, and there are resources and support systems available to help you through this. We'll break down the basics of gastrointestinal cancer in dogs, explaining the key concepts in a clear and accessible way. From the early signs and symptoms that might indicate a problem, to the various treatment options that are available to combat this disease. We'll also discuss important aspects of home care, providing you with practical tips on how to support your dog's recovery and maintain their quality of life. It's crucial to remember that this information isn't a replacement for your veterinarian's professional advice, but it will significantly help you understand the diagnostic and treatment process, empowering you to participate actively in your dog's care and ask the right questions during consultations with your vet. Being informed allows for more productive conversations and collaborative decision-making. We'll cover in detail what GI cancer is, including the different types and their characteristics. We'll explain how it affects your dog's digestive system and overall health, and the potential complications that can arise. And most importantly, we'll discuss what you can do to support your dog, from seeking timely veterinary care to providing comfort and love. Remember, there are many resources and dedicated professionals, including veterinarians, oncologists, and veterinary nurses, are here to help you and your pet navigate this journey with compassion and expertise. You don't have to go through this alone. Let's approach this with hope and optimism, focusing on what we can do to improve your dog's quality of life. and an unwavering commitment to providing the best possible care for your beloved companion. The bond you share with your dog is built on a foundation of unwavering trust, unconditional love, and countless shared moments. When they're unwell and their health is compromised, it affects us deeply, stirring emotions of concern, empathy, and a strong desire to help them heal. By learning more about gastrointestinal cancer in dogs, by understanding the challenges and the possibilities, you're taking an active and empowered role in safeguarding your dog's health and well-being. You're showing them the same unwavering devotion, the same boundless love, and the same compassionate care that they so freely give to you every single day. So let's take the first step together, embarking on this journey of understanding. In understanding this complex condition and empowering ourselves to make informed decisions. Together, in partnership with your veterinarian and other pet health professionals, we can make informed decisions for your loyal companion, ensuring they receive the best possible care and support throughout their journey. What is gastrointestinal cancer? It's a question no dog owner wants to ask, but understanding it is vital for your furry friend's health. We're going to delve into the complexities of this disease, providing you with the knowledge you need to be proactive and informed. Let's break it down. We'll explore what GI cancer is, how it affects your dog, and what steps you can take to ensure their well-being. Think of this as your comprehensive guide to understanding and navigating this challenging condition. The GI tract runs from mouth to tail. It's a long and complex system responsible for processing everything your dog eats. From that initial bite to the final elimination, the GI tract is constantly working, digesting food and absorbing nutrients. It extracts the essential vitamins, minerals, and energy your dog needs to thrive, ensuring they have the fuel for all their playful activities. Cancer is when cells grow uncontrollably, ignoring the normal signals that regulate cell division. These rogue cells can form masses and disrupt the healthy functioning of the body. So GI cancer is abnormal cell growth in the digestive system. This means that tumors can develop anywhere along the GI tract, from the esophagus to the colon, impacting your dog's ability to digest and absorb food properly. Tumors can block food, preventing it from passing through the digestive system. This blockage can lead to discomfort, vomiting, and a loss of appetite, cause bleeding, which can result in anemia and weakness. Internal bleeding is a serious symptom that requires immediate veterinary attention or spread to other organs. This process, known as metastasis, can make treatment more challenging and impact the overall prognosis. This disrupts your dog's ability to eat and get nutrients, leading to malnutrition and a weakened immune system. A healthy diet is crucial for a dog's well-being, and GI cancer directly interferes with this, leading to rapid decline. The effects of GI cancer can be devastating, impacting your dog's quality of life and overall health. The most common types are adenocarcinoma, a cancer that arises from the glandular cells lining the GI tract. It's often aggressive and requires prompt treatment. Lymphoma, a cancer of the lymphatic system that can affect the GI tract. It often presents with enlarged lymph nodes and can be treated with chemotherapy. And the rarer leiomyosarcoma, a cancer that develops from the smooth muscle tissue of the GI tract. This type can be particularly challenging to treat. Each type behaves differently and needs specific treatment. Therefore, accurate diagnosis is paramount to ensure the best possible outcome for your dog. Early detection is crucial because the sooner GI cancer is diagnosed, the more treatment options are available. Regular checkups with your veterinarian are essential. Problems in the GI tract quickly impact your dog's health. The digestive system plays such a vital role. Any disruption can have cascading effects. Rapid weight loss, dehydration, and weakness can result, signaling that something is seriously wrong. Don't ignore these signs. Seek veterinary attention immediately. Acting quickly gives your dog the best chance of successful treatment and a longer, healthier life. Your vigilance and prompt action can make all the difference. You know your dog best, so you'll notice when something's wrong. Persistent vomiting, especially with blood or coffee grounds, is a major red flag. Chronic diarrhea, dark or bloody stool, or any lasting change in bowel habits should prompt a vet visit. Unexplained weight loss, loss of appetite, and muscle loss are serious warning signs. Lethargy, weakness, and signs of abdominal pain, like a hunched posture or reluctance to be touched, are also concerning. Don't ignore these symptoms, especially if they last more than a day or two. Trust your instincts. If something feels off, see your vet. Early action can make all the difference. The first question many ask is, why did this happen? It's not your fault. The causes of GI cancer are complex. Genetics, age, and chronic inflammation all play a role. Some breeds, like Belgian Shepherds and Collies, are more at risk. Cancer is more common in older dogs, usually over 8. Chronic digestive issues like IBD can increase risk, so managing these conditions is important. Environmental and dietary factors are still being studied, but no single cause is proven. Focus on what you can control: a healthy lifestyle and regular vet care. Cancer is multifactorial. Prevention means managing what you can. If your dog shows symptoms, your vet will start with a thorough exam. They'll check for pain and lumps and overall condition, then recommend blood tests to look for anemia or organ issues. Imaging, like X-rays and especially ultrasound, helps spot tumors or blockages. The only way to confirm cancer is with a biopsy, where a tissue sample is examined under a microscope. Biopsies can be done with a needle, endoscopy, or surgery. This step identifies the cancer type and guides treatment. Your vet will explain each step and what to expect. Early accurate diagnosis is key to the best outcome. Trust your vet's expertise. They're your partner in this journey. Receiving a cancer diagnosis for your beloved dog can feel like the ground is shifting beneath your feet. It's an incredibly difficult moment, filled with uncertainty and fear. The news is heartbreaking, and it's natural to feel overwhelmed. You might find yourself grappling with a range of emotions, from sadness and disbelief to anger and anxiety. But it's important to remember that while a cancer diagnosis is undoubtedly serious, there are treatment options available. Modern veterinary medicine has made significant strides in cancer care, offering a variety of approaches to help manage the disease and improve your dog's quality of life. The primary goal of treatment is to control the cancer, slowing its progression and alleviating any associated symptoms. Simultaneously, we aim to maintain your dog's quality of life, ensuring they can continue to enjoy their favorite activities and experience joy each day. We want them to still be able to enjoy their walks, playtime, and cuddle time with you. The specific course of treatment will depend on several factors, starting with the type of cancer your dog has been diagnosed with. Different cancers behave differently and respond to various treatments in unique ways. The location of the tumor or cancerous cells within your dog's body is another crucial consideration. Tumors in certain areas may be more challenging to treat or remove surgically. We also need to assess whether the cancer has spread to other parts of the body, a process known as metastasis. The extent of the spread will influence the treatment approach. Finally, your dog's overall health and any pre-existing medical conditions will play a significant role in determining the most appropriate and safe treatment plan. We want to ensure they are strong enough to handle the treatment. The main treatment options available typically include surgery, chemotherapy, and in some cases, radiation therapy. Surgery is often employed to physically remove tumors from the body, aiming to eliminate the primary source of the cancer. Chemotherapy utilizes medications to target and destroy any remaining cancer cells that may have spread or are likely to spread throughout the body. Radiation therapy, while effective for certain cancers, is less commonly used for gastrointestinal (GI) cancers in dogs. It's important to understand that chemotherapy in dogs is primarily focused on maintaining a good quality of life. As a result, the side effects are usually mild and manageable, far less severe than what humans often experience. Your veterinarian will closely monitor your dog throughout the treatment process, helping to manage any side effects that may arise and adjusting the treatment plan as needed to ensure their comfort and well-being. In some fortunate cases, a complete cure is possible, allowing your dog to return to a normal, healthy life. In other situations, the primary focus shifts to providing comfort, managing pain, and ensuring your dog experiences as many good days as possible. Open and honest conversations with your veterinarian are essential for setting realistic goals and making informed decisions about your dog's care. Regardless of the specific circumstances, there is always hope for more happy moments together, more opportunities to cherish the special bond you share with your canine companion. For most GI cancers, surgery is the main treatment. The goal is to remove the tumor and some healthy tissue to prevent recurrence. Early diagnosis increases the chance of complete removal and cure. Sometimes, surgery is palliative, relieving blockages or pain when cure isn't possible. Recovery involves rest, special diets, and close monitoring for complications. Follow your vet's instructions for the best outcome. Surgery can be life-changing, especially if caught early. Even when cure isn't possible, surgery can improve quality of life. every decision is made with your dog's comfort in mind. Managing side effects is key to your dog's comfort during treatment. Appetite loss and nausea are common. Your vet can prescribe medications and suggest tempting foods. Nutrition matters. High-calorie, digestible diets help maintain strength. Track your dog's food intake and weight and call your vet with concerns. Create a calm, comfortable space and adjust activities to your dog's energy. Emotional support is powerful. Your presence reassures your dog. Keep a log of symptoms and side effects to share with your vet. Communication with your veterinary team is vital. You're an essential part of your dog's care team. Together, you can make treatment as smooth as possible. While we can't prevent all cancers, we can support our dog's health. Feed a balanced diet, provide regular exercise, and offer a loving home. Annual vet checkups, twice yearly for seniors, catch problems early. Early detection means more options and better outcomes. Manage chronic digestive issues with your vet to reduce cancer risk. Advances in veterinary medicine offer more hope than ever. A cancer diagnosis is tough, but it's not the end. Your love and care are what matter most. Cherish every good day and celebrate small victories. As pet parents, we dedicate ourselves to providing the best possible lives for our furry family members. We cherish their playful antics, their unwavering loyalty, and the unconditional love they shower upon us every single day. Our bond with our dogs is built on love and shared moments, from cozy cuddles on the couch to exhilarating adventures in the park. These connections are what make them such integral parts of our lives. We know their quirks and routines, the way they tilt their head when they're curious, the excited dance they do before mealtime, and the specific path they like to take on their daily walk. This intimate knowledge of their habits and behaviors makes us their first line of defense for their health, allowing us to notice subtle changes that might indicate something is amiss. We are the guardians of their well-being, always vigilant and ready to act. That's why it's important to talk about a serious topic, a health concern that, while not widely discussed, can significantly impact our beloved companions. We're going to address prostate cancer in male dogs. It's a condition that requires our attention and understanding. Hearing cancer is scary, and it's natural to feel a wave of anxiety when faced with such a diagnosis, or even the possibility of one. But knowledge empowers us to care for our pets, transforming fear into proactive care and informed decision-making. By understanding prostate cancer, its potential symptoms, and available treatments, we can make informed decisions and support our dogs through any challenge, ensuring they receive the best possible care and maintain a good quality of life. This guide will walk you through, step by step, what prostate cancer is, including its causes and how it affects the body, what to look for, the signs and symptoms that might indicate a problem, and what can be done, exploring the various diagnostic and treatment options available. Prostate cancer in dogs is uncommon but serious, requiring prompt attention and a proactive approach. And early awareness can make a big difference, significantly improving the chances of successful treatment and a positive outcome. Think of this as another way to enhance the care you already give your dog, adding another layer of protection and ensuring their continued well-being. Let's approach this topic calmly, with a clear and focused mindset, focusing on practical knowledge and the love we have for our companions, allowing us to make informed decisions that prioritize their health and happiness. Remember, you're not alone. This journey is one we can navigate together. There's a community and veterinary professionals ready to support you, offering guidance, expertise, and a compassionate understanding of the challenges you may face. To understand prostate cancer in our canine companions, it's essential to first familiarize ourselves with the prostate gland itself. This small but significant gland plays a vital role in a male dog's reproductive system, and understanding its normal function is key to recognizing when things go wrong. We'll delve into the anatomy, the physiology, and the potential problems that can arise, setting the stage for a clearer understanding of prostate cancer. So let's start with the basics of the prostate gland. We'll explore its location, its structure, and its primary functions within the male dog's body. Think of this as a quick anatomy lesson, providing the foundation we need to understand the complexities of prostate cancer and how it can impact our furry friends. In male dogs, the prostate sits behind the bladder, nestled in a crucial area of the lower abdomen. Its proximity to other vital organs means that any enlargement or abnormality can have a significant impact on a dog's overall health and well-being, and surrounds the urethra, the tube that carries urine from the bladder. This close relationship is important because prostate issues can often manifest as urinary problems. The prostate's position makes it a key player in both urinary and reproductive functions. The prostate gland is responsible for producing fluid for sperm transport. This fluid, a component of semen, helps to nourish and protect sperm, ensuring their viability and facilitating fertilization. It's a critical part of the reproductive process in male dogs. Normally, it's small and causes no issues, allowing your dog to live a happy and healthy life without any discomfort or complications related to this gland. A healthy prostate is a silent partner in your dog's overall well-being, but cancer occurs when its cells grow uncontrollably, dividing and multiplying without the normal regulatory mechanisms in place. This unchecked growth leads to the formation of a mass that disrupts the normal function of the prostate, ultimately forming a malignant tumor. This tumor can invade surrounding tissues and organs, causing further complications and impacting the dog's quality of life. Early detection and intervention are crucial in managing this disease. Prostate cancer is aggressive, meaning it tends to grow and spread relatively quickly compared to some other types of cancer. This rapid progression underscores the importance of vigilance and prompt veterinary attention if any suspicious symptoms arise, and can spread to lymph nodes, the small bean-shaped structures that filter lymph fluid and play a crucial role in the immune system. Cancer cells can travel through the lymphatic system and establish themselves in these nodes. Lungs, making breathing difficult and impacting overall oxygenation of the body. The lungs are a common site for metastasis, or the spread of cancer cells from the primary tumor, and bones. This can cause pain, lameness, and even fractures. Bone metastasis is a serious complication of prostate cancer, significantly affecting a dog's mobility and comfort. This makes it a serious condition, requiring a comprehensive and proactive approach to diagnosis and treatment. The potential for spread to other organs makes early detection all the more critical. Not just a local problem confined to the prostate gland itself. The systemic nature of prostate cancer means that its effects can be felt throughout the dog's body, impacting multiple organ systems. It's important to distinguish prostate cancer, a potentially life-threatening disease, from benign prostatic hyperplasia, BPH, a condition that shares some symptoms but has a very different underlying cause and prognosis. BPH is a common, non-cancerous enlargement in older, unneutered dogs, driven by hormonal changes associated with aging. While it can cause discomfort, it's generally not life-threatening. BPH is usually treatable by neutering, which reduces the hormonal stimulation of the prostate gland and leads to a decrease in its size. This is a relatively simple and effective solution for most cases of BPH, but prostate cancer can affect dogs of all ages and breeds, both neutered and intact dogs. This is a crucial distinction, as neutering is not a preventative measure against prostate cancer, unlike its effectiveness in treating BPH. The most common type of prostate cancer in dogs is adenocarcinoma, a malignant tumor that arises from the glandular cells of the prostate. Adenocarcinoma is known for its rapid progression, making early detection and aggressive treatment essential for improving a dog's chances of survival and maintaining a good quality of life. Tumors in this area can cause trouble with urination, leading to straining, frequent attempts to urinate, and even blood in the urine. These urinary symptoms are often the first signs that something is wrong with the prostate, or defecation due to their location, resulting in straining to defecate, constipation, and discomfort. The prostate's proximity to the rectum means that an enlarged or cancerous prostate can put pressure on the colon, affecting bowel movements. Understanding this helps explain the symptoms we might see in our dogs, allowing us to be more observant and proactive in seeking veterinary care when necessary. Recognizing these signs early can make a significant difference in the outcome. Many pet owners wonder why prostate cancer happens. The exact cause isn't always clear, but some risk factors are known. Age is a major factor. Most cases occur in dogs 9 years or older. Certain breeds like Dobermans, Shetland sheepdogs, Scottish Terriers, Beagles, and German short-haired pointers are at higher risk. Genetics likely play a role, but any dog can be affected. Unlike in humans, neutering doesn't prevent prostate cancer in dogs. In fact, neutered males may have a slightly higher risk. Other possible factors include chronic inflammation or environmental toxins, but these links aren't fully understood. The main risk factors remain age, breed, and neuter status. Knowing these helps you and your vet tailor your dog's wellness plan as he ages. Dogs can't tell us what's wrong, so we must watch for subtle changes. Early symptoms often involve urination, straining, weak stream, or increased frequency. Blood in the urine is a red flag and needs immediate veterinary attention. Tumors can also press on the colon, causing straining to defecate or ribbon-like stools. Constipation or pain during bowel movements are warning signs. As cancer progresses, you may notice lethargy, loss of appetite, and weight loss. If the cancer spreads to bones, signs like lameness or a stiff gait may appear. These symptoms can mimic other conditions, so don't panic, but do act. The combination of several signs, especially in older dogs, should prompt a vet visit. Early action is the best way to help your dog. If you notice concerning symptoms in your furry friend, such as difficulty urinating, straining, or blood in the urine, it's essential to seek veterinary attention promptly. These signs could indicate prostate issues, and early detection is key to effective management. Your vet will start with a thorough physical exam to assess your dog's overall health. This hands-on examination allows the vet to feel for any abnormalities, such as an enlarged prostate or signs of discomfort. They'll also check vital signs like heart rate and temperature to get a comprehensive picture of your dog's condition. A rectal exam is a crucial part of the diagnostic process, allowing the vet to directly assess the size, shape, and texture of the prostate gland. This examination helps determine if the prostate is enlarged, asymmetrical, or has any unusual masses. If abnormalities are found during the physical or rectal exam, further tests will be necessary to determine the underlying cause. These tests help to differentiate between various prostate conditions, such as benign prostatic hyperplasia, BPH, prostatitis, or cancer. Blood work and urinalysis are essential for checking for infection, inflammation, or other systemic issues that could be contributing to the prostate problem. These tests can also help assess your dog's overall organ function and identify any other underlying health concerns. Imaging techniques like X-rays provide valuable insights into the size and shape of the prostate, as well as the surrounding structures. Ultrasound offers a more detailed visualization of the prostate and nearby organs, allowing the vet to assess the internal structure of the gland and identify any abnormalities. Ultrasound is especially useful in evaluating the prostate because it can differentiate between fluid-filled cysts, abscesses, and solid masses. It's particularly effective for spotting tumors or other subtle changes in the gland's texture and appearance that might be missed on X-rays. Chest X-rays may also be recommended to check for any signs of cancer spread or metastasis to the lungs, which is a common site for prostate cancer to spread. For a definitive diagnosis, especially when cancer is suspected, a tissue sample is needed for microscopic examination. This can be obtained either through a less invasive fine needle aspirate, which collects cells, or a more involved biopsy, which takes a small tissue sample. These samples are then carefully examined by a veterinary pathologist, a specialist in diagnosing diseases through microscopic analysis. The pathologist analyzes the cells or tissue to confirm the presence of cancer, determine its specific type, and assess its grade, which indicates how aggressive it is. This detailed information is absolutely crucial for planning the most effective and appropriate treatment strategy for your dog's specific condition. Your vet will guide you through each stage of the diagnostic and treatment process, ensuring you understand all the options and can make informed decisions about your dog's care. They are your partner in helping your dog live a long and healthy life. A prostate cancer diagnosis is tough, but there are treatment options to help your dog. The best plan depends on the cancer type, spread, and your dog's health. Surgery to remove the prostate is possible but risky, often leading to incontinence and not always recommended if the cancer has spread. Chemotherapy is commonly used to slow tumor growth and improve quality of life, with fewer side effects than in humans. Many dogs tolerate chemo well and can enjoy their daily routines. Radiation therapy can shrink tumors and relieve symptoms, especially if the cancer has spread to bones. Newer techniques like stereotactic radiation therapy offer targeted treatment with fewer side effects. Your vet or a veterinary oncologist will help you choose the best approach. Managing side effects is key to keeping your dog comfortable during treatment. Some dogs may have mild nausea, appetite loss, or lethargy after chemo or radiation. Your vet can provide medications to ease these symptoms. At home, create a calm, cozy space and offer small, tasty meals to encourage eating. Pain management is crucial, especially if the cancer affects bones. Never give human pain meds, and follow your vet's instructions. Watch for signs of pain or discomfort and report them to your vet for adjustments. Emotional support matters too. Spend quiet time together and keep routines gentle. Your love and attention are the best comfort you can give. While we can't prevent prostate cancer, we can catch it early and support our dog's health. Regular vet checkups, especially for seniors, are essential. These include rectal exams to spot changes early. Early detection means more treatment options and better outcomes. Watch for changes in urination, bowel habits, energy, or gait, and don't hesitate to call your vet. A healthy diet, regular exercise, and minimizing exposure to toxins all support overall well-being. Being informed and observant is a powerful form of prevention. Know your dog's risk factors and symptoms and maintain a strong relationship with your vet. This proactive approach gives your dog the best chance for a long, happy life. Facing prostate cancer in your dog is hard, but there is hope. Veterinary medicine is advancing, with new treatments and better outcomes every year. You're not alone. Veterinarians and specialists are here to help. Your love and commitment are the foundation of your dog's care. Stay informed, observe your dog, and work closely with your vet. Take care of yourself too. Channel worry into positive action for your pet. Cherish every moment, and don't hesitate to seek support when needed. Your proactive care and love give your dog the best possible life. That's the greatest gift we can offer our loyal companions.